Hey there, happy Tuesday. I hope you are doing well. Today, we're going to be talking about the answer to a surprising question that I once got on a meet and greet call. Meet and greet calls for me are a part of the application process for the accelerator program that I run called Health Professionals to Health Writers. And so this question came up at the end of one of those calls where I kind of opened the floor to the potential student to see what questions they have for me and what more they want to know about the program or the experience. And the question, as you might be able to tell from the title of this video, the question that person asked was, um, with all due respect, as she prefaced it, why am I creating competition for myself as a health content writer by training other pharmacists and healthcare professionals on how to be freelance health content writers too? I think she was trying to get at the question of why, like, why am I doing this when I could just, have more work for myself or have more opportunities for myself? Why the need to kind of share those opportunities with other folks? So was I never gotten that question before, so I was a little bit taken aback, but I was also really grateful that she asked that question, because it allowed me a chance to kind of verbalize the why behind why I created the program. And I also just thought it was kind of a bold question for her to ask, which I appreciate because, as you know, if you follow my account, I keep it real with y'all, and I appreciate when y'all keep it real with me as well. So I really appreciated that dialogue. Before I dive into the answer that I gave her and my general answer as to why I do this, I will introduce myself for anyone who I haven't had the opportunity to meet yet, or if you haven't had the opportunity to join any of my live sessions about health content writing. My name is Megan. I'm a public health pharmacist by training, but years ago, I transitioned over to health content strategy. And so I run a program called Health Professionals to Health Writers that helps pharmacists and health professionals learn how to replace a portion of their primary income, specifically through freelance health content writing. So, what you'll see on my LinkedIn account is that I talk a lot about medical writing and health writing, but there are a lot of different types of medical and health writing. And the specific type that I specialize in is called health content writing. So that is the type that I am an expert in. If you have questions about medical communications, formal medical writing, scientific publications, I can kind of give you general knowledge and point you in the direction of someone or some resource who might be able to help you further. But that is not my particular area of expertise anymore. I don't work in those areas anymore. I hang out in the health communications and health content writing space. So nice to meet you. If you have questions or comments, feel free to drop them, whether you're watching live or whether you're catching the replay. I'll still be able to see them. And I really appreciate you being here for this conversation. So let's jump into the answer of why I am, quote unquote, creating competition for myself by training other health professionals on how to be freelance health content writers. So, reason number one. Um, I believe that more health professionals should be health communicators, meaning that I think more people who have formal backgrounds in healthcare, whether that's pharmacy, nursing, medicine, physical therapy, mental health, any type of formal health professions training, I think more of those people should be the people who are delivering health communications to the general public. And the reason for that is because we have the training, we have the expertise, we oftentimes know how to communicate scientific information with people who don't necessarily have a scientific background. And there are a lot of people out here who are communicating health information who are actually communicating misinformation, sometimes unintentionally, sometimes intentionally. And so I believe that more people who have an actual who have actual formal training in healthcare should be the people who are communicating health information. And it just so happens that one of the lowest barriers to entry into health communications is through freelance health content writing. Health communications is not something that is, I wouldn't necessarily say hard to get into, but it is something that is helpful to have specific training for. And the reality is that even though as healthcare professionals, we have the expertise, we have the experience, we have the education, we don't necessarily have the experience with communicating health and scientific information unless we have intentionally taken that path. Right. So I have a deep background in writing and communications because I came into pharmacy knowing that I was going to take that path, or knowing that I wanted to go into public health, and knowing that writing was the skill that would help me make that transition. Not everyone has that luxury because sometimes people don't realize it's an option. They don't realize it's something they're interested in. They don't know that early enough in order to gain those opportunities for themselves. So there are a lot of reasons why you could be in your career as a healthcare provider, as a pharmacist, as a physician, as a nurse, and you might never have had the opportunity to be a writer or be a communicator because it's just not something that was on your radar. I believe that there should be more opportunities for people to transition into health communications, and freelance health content writing is one of the best ways to do that. It's one of the lowest barriers to entry. And so that's part of the reason why I created this program, because I want to contribute to increasing the inventory, if you will, of health professionals who are also health communicators. The second thing, and kind of the why behind that why, is it gets into the reason why I believe more health professionals should be health communicators. And that reason is based on my personal professional mission, which is to fight health misinformation online. When I look back on all of the different professional opportunities and roles that I've had, and the ones that have resonated with me the most, the ones that have molded my career the most, the ones that have been the most personally and professionally fulfilling, they have all been geared towards fighting health misinformation, and particularly fighting health misinformation online. And when I became a freelance health content writer, I wanted to continue that, right? And I still want to continue that in my work and in everything I do. That is the common thread that connects between all of the work that I have done and that I will do, likely in the future. But the thing is that fighting health misinformation is not a solo job. Like, that is not just a thing that I do and no one else can do it, or no one else is cut out for it, or no one else wants to do it. That's not the case. It's not just something that's for me. So when I was operating full time as a freelance health content writer, what I realized was that, one, from a business perspective, in order to kind of grow and expand, one of the things that you have to consider as a service provider is whether you want to go into an agency model where where the way that you expand your capacity is by bringing on other people onto your team who are able to do what you do. So basically, bringing on other writers who can expand capacity and then allow my company stock roles to take on more work. That was one way of being able to not only scale from a business perspective, but scale the impact of what I was doing as a freelance health content writer. The very transparent reality was that I was not interested in an agency model. There was nothing about an agency model that that interested me in terms of the logistics, the operations, the all the things that come with running an agency. Just not my cup of tea. A personal preference, not what I was interested in. And I found myself continuously, like, avoiding really asking myself that question: is this something that you really want to do? And instead, I would procrastinate. I would find other things to do. I would distract myself with other things so that I didn't have to focus on this question of, do you want to or do you not want to start an agency? And eventually, I was kind of forced to say, okay, Megan, you have to answer this question, and the answer to this question is no, I'm not interested. But what I could do, or what I had to figure out how to do, was, if I am not going to be able to scale my mission of fighting health misinformation online through an agency, I have to figure out another way to do that. Because again, I don't want this to begin and end with me. I want that impact to expand far beyond that. And so the way that I decided to scale that impact was through the creation of the Health Professionals to Health Writers program, because I knew that even though I don't want to be responsible for the other writers who can do this work, I do want to help train those other writers, right? I do want to help bring other people with a similar background as me into this world so that they can then take their newly gained knowledge and expertise as health content writers, and we can scale the mission of fighting health misinformation in that way. So by training other people in how to do what I'm doing, I am scaling that impact without having to be directly responsible for those folks within an agency model, and creating a business structure that I will ultimately hate, just being honest. So that was the second reason why I decided to create this program and create competition for myself, is because I don't see it as competition. I see these as opportunities to extend the impact that I want to make through my career and through my work, which is fighting health misinformation online, and giving other people the power, the skills, the experience to be able to do that as well. And the third thing kind of leads or is related to that as well. The fact is that there is more than enough, more than enough space and opportunity for health professionals who want to become health content writers, right? Think about the entire landscape of not just the healthcare system, but the public health infrastructure, right? Think about all of the types of organizations, companies, service providers, care facilities, all of the different facets of our healthcare and public health infrastructure. All of those are companies and groups and organizations that could potentially benefit from health content writing and spreading their message to the people who really need it, right? So there is no shortage of pharmacists, there is no shortage of opportunities for pharmacists, physicians, nurses, PTs, whomever who wants to take their clinical expertise and use that to create communications and create content for lay audiences, to help fight health misinformation. So that is really the third thing. Is I don't look at it as competition. I look at it as utilizing the resources that I have and providing those resources to other people so that they can also help fight this misinformation and disinformation that has very real, very lasting impact on our communities. So I could keep going and rambling on about this, but I think that those 3 points kind of make it clear why I got into this work and why I chose to create this program and bring more health professionals into the health content writing fold. I will also add that I am currently enrolling for the May cohort of the Health Professionals to Health Writers program. This is actually the first announcement of the fact that enrollment is open. There will be 6 students in the May cohort. There are already 3 students who have enrolled in the program, and so there are 3 spots left. If you are interested in potentially joining, you can leave a comment that just says write, WRITE, and I can shoot you a message to discuss more details about the program. Keep in mind that the program in its current state is only open to US-based healthcare providers, so pharmacists, nurses, physicians, public health practitioners, and US-based at this current time. Otherwise, if you have questions, feel free to drop them in the comments and we'll chat later.